Hello, my name is Dr. Richard Nkwenti. This video podcast focuses on the importance of maintaining stable serum T3 levels in humans. It explains that T3, the active form of thyroid hormone, is produced both by the thyroid gland and through peripheral tissue deiodination of T4. The authors explore the complex mechanisms involved in regulating T3 levels, including the hypothalamus, pituitary thyroid axis, and the various deiodinase enzymes. They highlight that the body prioritizes stable T3 levels, even adjusting other hormone levels to achieve this. The article then delves into the clinical implications of these findings, particularly regarding the treatment of hypothyroidism with levothyroxine monotherapy versus combination therapy with levothyroxine and liothyronine. While acknowledging that some hypothyroid patients may not fully normalize their T3 levels with levothyroxine alone, the authors present a nuanced perspective on the benefits and limitations of combination therapy, emphasizing the need for further research and improved delivery mechanisms for liothyronine. What you will learn. What are the implications of maintaining stable serum T3 levels for thyroid hormone homeostasis? How does the hypothalamus pituitary thyroid axis regulate serum T3 levels in the absence of extrathyroidal T3 production? What are the potential clinical benefits and limitations of combining levothyroxine and liothyronine treatment for hypothyroidism? How to properly manage Hashimoto using LDN?
Ever feel like you're stuck on autopilot, even after a full night's sleep? Like you're just wading through this mental fog, no matter how much coffee you try to blast through. You, my friend, are not alone. And what's even wilder is that there might be this tiny hormone behind those feelings, T3.
Right.
Today, we're going deep, and I mean deep into the science of T3 and why it matters more than you might think. We're talking about unearthing those surprising connections, those aha moments that make you see this whole thyroid thing in a whole new light.
What's fascinating is that most people, they know about the thyroid gland, but T3 often gets overshadowed by its more, well-known counterpart, T4.
It's true. It's like T3 is the quiet achiever, diligently working behind the scenes while T4 hogs the spotlight. But get this, T3 is the real MVP, the active player in your thyroid system.
Absolutely. Think of T4 like a messenger carrying a vital message, but it needs to be converted into T3 for that message to actually be, delivered and put into action by your cells. So T3 is like the key that unlocks your cell's receptors, triggering the actions that keep your metabolism humming, your brain firing on all cylinders, and your energy levels up.
Okay, so let's unpack this whole conversion process, because you might be shocked to learn that the majority of T3, we're talking a whopping 80%, isn't even made in the thyroid gland itself.
It's mind-blowing, right?
It's wild.
Huh. While your thyroid gland produces some T3 directly, the bulk of it is actually generated outside the thyroid in different tissues throughout your body. This highlights just how important this conversion process is for your overall health, because even if you have a perfectly healthy thyroid gland, if that conversion isn't working optimally, you might not have enough T3 to meet your body's needs.
Which makes you wonder, are those standard thyroid tests even telling the whole story? This is why we're digging deeper today. And one thing that totally blew my mind when I was prepping for this deep dive was learning just how stable T3 levels are in healthy individuals. It's like this perfectly orchestrated balancing act, even though T3 has a pretty short lifespan in the bloodstream.
You're right. It's a testament to your body's incredible ability to maintain equilibrium, constantly making tiny adjustments to keep, everything running smoothly. It's like a master conductor, right? Ensuring every instrument in an orchestra is perfectly in tune.
Okay, so walk me through this. How does our body pull off this magic trick?
So there are two main systems at play. First, we have the hypothalamus pituitary thyroid axis, or HPT axis for short.
Catchy.
Now, I know that sounds complicated, but stick with me. This system acts as a feedback loop. If your T3 levels drop, it's like an alarm bell goes off, signaling your thyroid to produce more hormones. But there's a catch. This system can only compensate so much.
That makes sense. You can't just crank the thyroid up endlessly. There has to be another layer of control, right? It can't just be constant emergency mode.
You're exactly right. And that's where those amazing little helpers, the deiodinase enzymes, come in. Think of them like tiny chefs in your cells, transforming the raw ingredients, that's T4, into the delicious meal your body can actually use, which is T3.
I love that analogy. So it's not just a matter of having enough T4, but making sure it gets converted into that usable T3 form, right?
You got it. And these deiodinase enzymes, they're like a quality control team, ensuring each cell gets the right amount of T3 at the right time. Now, there are a few different types of these enzymes, but a key player here is D2, which is particularly active in the brain, pituitary gland, and brown adipose tissue, all energy-hungry parts of your body. And get this, studies in mice have shown that even when both main deiodinases are knocked out, the body still finds a way to keep T3 levels stable.
It's incredible.
It's incredible.
So our bodies have backup plans for their backup plans when it comes to T3, which makes you wonder, what happens when even those backup systems get overwhelmed?
This brings us to a crucial point about how we typically treat hypothyroidism, which, as you might know, is when your thyroid isn't producing enough hormones in the first place.
Yeah. That's right. We typically turn to medications like levothyroxine, which is a synthetic form of T4 that's designed to, boost those low thyroid hormone levels.
But, and you knew there was a but coming.
Always a but,
Yeah.
right? Especially when we're talking about something as, intricate as our endocrine system. And this is where we bump into what I call the levothyroxine conundrum. While it's undeniably effective for many people, studies show that a significant number of patients on this therapy still have lower than normal T3 levels, even when their TSH levels, which, doctors typically use to measure thyroid function, are well within the normal range.
Okay, now I can practically hear the question swirling in your head. Wait a minute, you might be thinking, my doctor hasn't mentioned any of this. Why am I just now finding out about potentially low T3? It's a totally valid concern, and there are a few reasons for this. First off, T3 testing itself has its limitations. As we discussed earlier, T3 levels can fluctuate throughout the day, right? Plus, different labs use different testing methods, and this can affect the results.
So it's not always as simple as getting a blood test and having a clear-cut answer.
Unfortunately not. And to make things even more complex, research is still ongoing to figure out just how important those mildly low T3 levels are, in the grand scheme of things. We know it's not ideal, but scientists are still unraveling exactly how much it contributes to, specific symptoms and long-term health outcomes.
Which brings us to the big question I bet you're asking yourself right now. Okay, so maybe my T3 is a bit low, but does it really matter? What are the real tangible downsides, even if they're subtle?
This is where it gets really interesting. While more research is always being done, there's growing evidence that even mildly low T3 can have some not-so-fun consequences. For example, studies have linked low T3 to weight gain and higher cholesterol, even in those with hypothyroidism who have, normal TSH levels. There's even research suggesting a connection between low T3 and increased use of statins, those cholesterol-lowering medications in these folks, compared to healthy individuals.
So we're not just talking about feeling a little sluggish. This could have real implications for your metabolic health down the road.
Potentially, yes. And then there's the elephant in the room. Those persistent hypothyroid symptoms that just won't quit. Many people taking levothyroxine report ongoing fatigue, brain fog, low energy, the whole 9 yards, despite having normal TSH levels. Imagine feeling like you're dragging yourself through each day, even when the standard tests say you should be feeling fine.
It makes you wonder if low T3 could be the missing piece of the puzzle, the reason those symptoms linger, even with treatment.
It's definitely a strong possibility. And to illustrate just how complex this issue can be, let's dive into a fascinating case study from the LDN Research Trust. This story revolves around a patient who, despite conventional treatment for Hashimoto's thyroiditis, an autoimmune condition that often leads to hypothyroidism, continued to struggle with a whole bunch of symptoms: fatigue, weight gain, hair loss, mood swings, you name it.
So this person was doing everything right according to standard medical protocols.
Yeah.
But they were still feeling awful.
Exactly. Now, it's important to remember that this is just one case, but it highlights something crucial. Thyroid treatment isn't one size fits all. This patient found significant relief after starting low-dose naltrexone, or LDN. Now, before you run out and try to get your hands on some LDN, I want to be crystal clear. This is not medical advice. It is crucial to talk to your doctor about any treatment decisions. What this case does show is that there might be other avenues to explore when it comes to optimizing T3 levels, especially when the usual approaches aren't cutting it. It's about working with your healthcare provider to find what works best for you.
This is why I find these deep dives so fascinating.
Yeah.
We're peeling back the layers on something our bodies are doing every second of every day.
Right.
And most of us aren't even aware of it.
It really underscores how much we're still learning about the complexities of thyroid function, and especially the often underappreciated role of T3.
Totally.
The good news is this area of research is absolutely exploding right now, which is incredibly exciting.
Okay, so let's end on a hopeful note, shall we? What does the future hold for personalized thyroid care, especially when it comes to T3. What's brewing on the horizon?
Well, there are two really promising avenues opening up.
Okay.
First, researchers are working hard to develop slow-release T3 medications.
Okay.
You see, as we touched on earlier, the T3 pills currently available can cause those dramatic spikes and crashes in hormone levels.
Right.
It's like riding a roller coaster, which isn't how your body naturally likes to do things.
Right.
These new delivery methods aim to create a much smoother, more natural T3 level throughout the day, no more wild ups and downs. And that could be a total game changer for a lot of people.
No more hormone roller coaster. Sign me up. What about that second frontier you mentioned?
Ah, yes.
Yeah.
This one delves into the world of personalized medicine.
Right.
It's all about genetic profiling.
Okay.
Scientists are discovering that variations in our genes, specifically the genes that code for those deiodinase enzymes and thyroid hormone transporters, can actually influence your individual T3 levels.
Interesting.
Yeah, it's like having a unique blueprint for how your body handles T3.
So are you saying that in the future you could get your genes tested to find out how efficiently you're converting T4 to T3 and then receive a treatment plan that's tailored specifically for you?
Precisely. It's about understanding the why behind those low T3 levels, getting to the root cause, not just throwing medication at the problem and hoping for the best.
Right. Yeah.
It's about fine-tuning your treatment to match your individual needs.
I love that. It truly feels like we're on the verge of a revolution in how we approach thyroid health.
I think so too. And it all comes back to something we've emphasized throughout this deep dive.
Yeah.
The importance of advocating for yourself, asking questions, and staying curious about your own health.
Couldn't agree more. So as we wrap up, here's a thought-provoking question for you to ponder. If you're dealing with hypothyroidism, even if your TSH levels are normal and those symptoms just won't quit, could optimizing your T3 levels be the missing piece of the puzzle? It's a conversation worth having with your doctor. And remember, this deep dive was just a glimpse into the fascinating world of T3. There's a whole universe of research emerging on this topic, so keep exploring, keep asking those questions, and, as always, stay curious.